Welcome to the Resurgence Athletics Podcast. My name is Dr. Ryan Goodell.
My name's Dr. Lucas Noguera.
And this is episode number 7. Right. We made it to 7.
We made it.
Feeling pretty good about that.
Yeah.
Look at us. And in today's episode, we're talking about ACLs,
All right.
ACL injuries, super common orthopedic injury, something that is in our wheelhouse.
Oh, yeah.
We see so many orthopedic injuries, and ACLs and sports injuries are very prevalent. Just in your experience in clinic and stuff like that, how often do you see ACL injuries?
Pretty often. I feel like we either preoperatively, postoperatively, or just someone just trying to get a little bit stronger after, a grade 1 tear of it. But I would say pretty prevalent.
Yeah, probably one of the more common sports injuries that people are most familiar with, and very long recovery process.
Oh, yeah.
Ligaments in general, long recovery process.
This is true.
And, we see the worst ones at the grade 3 level, and
Full rupture.
the mild ones kind of go under the radar sometimes.
This
But
is true.
The tears are the ones that people are most familiar with because their favorite athletes are normally the ones that need to take a whole season off because of that, right? But for those who don't know what an ACL is, do you want to explain what an ACL is?
Yeah, so your knee has a few ligaments down there that helps provide stability, structure to the knee. The ACL is also known as your anterior cruciate ligament. So it is one of the ones that will prevent the shin bone from translating forward on the thigh bone, which is your femur. And many times people have, like Ryan said, any kind of high velocity, high impact, twisting, quick changes in direction, that ACL is or can be compromised.
Structurally, that provides some translational resistance to prevent your shin from moving forward, and then rotational stability as well. That's why we see it so often in sports that require a lot of like stopping, pivoting. What activities are you at increased risk for? Those are typically what would you
I see the most when I see my ACL folks, it's usually a skiing or snowboarding injury. But soccer, you see football players, volleyball players, even tennis players, anything that requires that pivoting, quick change in direction, where that ACL can be vulnerable.
Yeah, and I think like skiing, we see a lot of those. See a lot in skiing. I think a lot of that has to do with your foot's on a fixed object too. Like we have something not normal on our foot, and then if you get caught in the snow or the ski catches the snow right, it adds that torsion to the knee, or the snowboard does too. I don't ski or snowboard anymore. I gave it a try.
I never have. And then after PT school and practicing as a physical therapist and seeing so many injuries with the ACL, I'm like, I'll pass. I don't really like the cold anyway, so
I remember I gave
not missing out on much.
I gave it a try in high school.
Okay.
And tried snowboarding once, and I was playing baseball at the time, and I was a catcher, so you're in a squatted position a lot. And I remember I had gone snowboarding and spent most of the day just falling down, and I was just tumbling down the mountain pretty much all day. And the next day I woke up, I was like, my knees feel so bad. And I was thinking about that. I was like, maybe this isn't the activity
not
for
worth
me.
It. No,
but super high incidence with skiing and
definitely.
Stuff. Who was one of the famous Olympians? Was Lindsey Vonn.
Yeah.
Tore her ACL too.
Oh, yeah.
And that's a lengthy recovery process. She was a downhill skier, correct?
Yes.
And she won a bunch of gold medals as well.
Did.
We got to promote the Olympic athletes.
There you go.
Right? So we mentioned a little bit the sports that we specifically see.
Yeah.
Injuries are skiing, football, soccer, basketball, tennis, rugby, anything where you're pivoting and you are twisting or changing directions. Highest risk for ACL injuries, but the majority of them are non-contact.
This is true.
So they're normally when you're moving quickly, and we mentioned previously in a prior podcast, velocity is increased risk of injury. And that is very true for the ACLs. The faster you're moving, the higher risk you have of tearing it, especially when you need to change directions. And then there's 3 different grades of ACL injuries. And what are those? You want to break those down for us?
Sure, yeah. So grade 1, just minimal tearing or, of the ACL itself. Usually just you have to rest, control the swelling, get the pain levels down, and then strengthen all the structures around the knee.
It's like you stretched it out a little bit.
Exactly. And then you have a grade 2, which is partial tearing of that ACL, not fully ruptured, so there's still some attachment points. This is where it gets a little iffy, where if you can treat it more conservatively. If you're a high-level athlete, you want to get back onto the field, you're most likely going to have to go for that surgery.
I feel like that's a mixed bag with the grade 2s. Like I've seen some go one way or another, right? Because it's a partial tear.
Exactly.
So that could be
What's
10%.
Exactly.
That could be 75%. You got some fibers intact still. I've even seen some things with like a PRP foam injection around those. They've been experimenting more with that. Seems to be slightly promising on that end, but I think there still needs to be a lot more research done on that. But considering how many ACL injuries occur every year in the United States, what we see there in prevalence?
I think it was 100,000 to 200,000 per year.
Pretty big range, but that's injuries, and that's accounting for anything from like grade 1 to grade 3. We always think about like the grade 3s. Those are like the surgical repairs, so that's obviously going to be lower, but a lot of people get grade 1s too, so the incidence of them is very high relative for knee injuries.
So that last grade, what Ryan just mentioned, it's that grade 3 where it's a complete rupture of the ACL. You're not walking with this, your knee's buckling, giving out on you. Very hard to just bear weight on the knee, so that one is where most of our patients will undergo that surgical intervention to regain that stability, strength, and whatnot.
And then sometimes people like tweak their knee or something, and then they're always like, "Well, how do I know specifically? Like, how did I do this? Like, how do we know it's that?" And there's some things we can do clinically that are beneficial that'll give us a good idea of if that ACL has been compromised. But the gold standard is the MRI. Overall, the most like if you were to assess an ACL, right? Like, we talked about the mechanics of it, right? Like it's that forward translation. It resists that. So that's what a lot of the tests that we do look at. If we can shift your shin forward relative to your femur. And that is called the...
So there's a few, but Lockman's would be your gold standard for the special tests. You can do an anterior drawers, pivot shift. We don't really do pivot shifts, but... And I don't know if you've seen one of these in person, Ryan, but it's very noticeable. Like that shin bone is very much like just sliding off of that thigh bone. It's almost kind of like gruesome to like see it. And
it's wild, if you look that up on Google, you're like, wow, that moves a lot. And it's like a shelf just shifts out from the knee, and you can like literally almost like catch it. Yeah, right. And
then if those are positive, then that's when I'm like, all right, let's probably go out and get an MRI. Let's schedule you for one of those and actually get that confirmation of what grade it is, what's the severity level, and then go from there.
Yeah, if you see a lot of instability, you're definitely going to want to refer out for that. And most of the time, they do come and see you with prior, at least an X-ray and possible MRI beforehand. But then the treatments kind of vary. There's a lot of variation depending on the severity of the tear. Like, again, like if they've totally ripped through it and they're an active person, they're probably going to be on the surgical track. The lower grades, the lower grade 2s, I'd say like the 1.5s, right? You can probably be okay. Some people are out there walking around with like 75% of their ACL, and they're going to be just fine. But if you're more active, you're probably going to end up on the surgical side of things. But we see people pre-surgery pretty often, because even before they go in there, they want to make sure the inflammation's under control and that you don't have any major range of motion restrictions before the surgery.
Maximizing the knee flexion extension as best you can.
So even before surgical intervention, they're going to have you go into PT, and we'll see you then, and we'll see you after the surgery. So those are kind of some of the pathways you go down, depending on the severity of it. And then with the surgery, what does that kind of involve? Because they have to take a graft from somewhere.
yeah.
So like, where are the traditional graft sites?
So the gold standard that I've seen done most often is the patellar tendon. They also take it a lot of times from the hamstring, so that semimembranosus, one of the hamstring muscles of the hamstring there, and then even sometimes the quad tendon. I haven't seen the quad tendon done that often, but I've had a few patients with that. And usually if they've gone or underwent another ACL surgery after failure for the first one.
Yeah. Which one do you think you would prefer to work with? Which type of graft?
I like the patellar tendon graft just because I think it's less restrictions, more freedom versus if you're taking, that hamstring tendon, you're going to be restricted in, stretching the hamstring, even strengthening and, range of motion. So,
yeah, I think the hamstring, when they take it from the hamstring, you have a lot of things to work around with that on the opposite side of the knee. And that one comes with a lot of discomfort too. I've always seen the patellar tendon seems to be the best results and the easiest coming back. But there's no ACL in the beginning that, is smooth sailing.
This is true.
You're always
up
like
and down.
second guessing your decision after an ACL. You're going, oh no. There's a lot of hurdles to get through mentally and physically out the gate after the surgery because it's sensitive. You have a lot of muscle guarding, a lot of swelling. You got the surgical incision, which needs to heal up. There's a lot that goes into that. So those first couple of months are like a big mental hurdle for a lot of people to get through.
Definitely.
But then the timeline for the recovery process, like that first phase, like after surgery, you have inflammation. So, those 3 phases of the healing process, inflammation, proliferation, remodeling. Those first couple of weeks and that first month, a lot of inflammation.
Yes.
And so we're just trying to control that, get some range of motion back. And then you really start doing things again more that you would consider like normal-ish at about like, what's the range there?
3 months, I would say. That's when you get, it gets a little more exciting, I would say.
Yeah. And if you're general like activity, like you're not doing much other than your daily stuff, the full recovery process, what would you say? That's probably around like
6 to 9 months, give or take.
You're gonna be walking again. You're gonna be going up and down the stairs. You're not gonna be. I mean, you're still gonna be thinking about it a little, but you're not gonna be super hesitant about it.
Yeah.
But if you're an active individual, like you're getting back to sports, you're moving fast. Like if you're a football player, you're getting hit too, right? There's contact. You need to be able to, have some physicality with it.
Sure.
You're looking 9 to 12 months.
Yeah.
Easily. And, it's one thing to be back and to be able to like move around and run and stuff, but then you add like force to it. And I think especially football, because I think that's one of the harder ACLs to go back to, and soccer, because there's the physicality of it where you're getting pushed around, you're getting hit, and the ACL needs to be able to withstand that. So even those timelines for the healing process are going to be a little more extended than someone who's like a runner or something like that.
Agreed.
Just because of the level of contact. And then there's also we get this with athletes all the time. It's like, I tore this. Could I have prevented this? Like, is it preventable? Is it even preventable?
I think to an extent, right? We talked about this a little earlier. Like, you want to keep your your leg muscle as strong as possible. And if you're, following a strength and conditioning program and diet, sleep, all of those factors play a role too. Mm-hmm. But to an extent, right? Sometimes these injuries happen so quickly, so abruptly that you can't have changed that, like in a tackle, right?
Right.
If you get tackled in the wrong way, like what could you have done differently?
Exactly.
At that point, if it's going to go, it's going to go.
Yeah. Like if you get hit, there's nothing you can do. Yep. Like, I mean, it's sometimes just things happen. That's the nature of the sport. And you can't like feel bad about yourself about that. Like it happens. Yeah. Things happen and you can't beat yourself up about it. And there's training protocols. Like we know having strong hamstrings is good. Yeah. We know having strong quads and having good balance and coordination and being able to shift into your hips and all those more athletic attributes you want to see. But sometimes things happen. And there's training protocols, there's ACL prevention programs, but there's no perfect program. I think that's the important thing to remember. You can just prepare as best you can, but you can't like hold back when you're out there on the field. You just got to be ready to go. Any long-term implications after the ACLs?
So, yeah, I mean, short-term first, right? Risk of re-injury are pretty high, especially if you didn't undergo a vigorous rehab program versus, and even the non-operative leg, right? You end up favoring one side and using that one side so much that you also are at risk to injure that leg as well. But down the line, like long-term, like developing arthritis, right?
Yep.
So anytime they open you up, right, and they do anything there, they're changing your anatomy.
Yeah.
That then puts you at a higher risk.
Delicate little ecosystem in your joint.
Yeah.
Like, and then whenever they go in there, you're running the risk for earlier onset arthritis.
Yep.
You know, so that might be something to consider further down the line.
Yeah.
But that's why it's good to have a good rehab afterwards, and that just sets you up for future success. And then we have some notable athletes who have had, we mentioned Lindsey Vonn earlier. Tom Brady had an ACL. He came back, but you might miss a whole season if you're a professional athlete because of that. Adrian Peterson, he had a big ACL injury, but he came back very good after his, and pretty quickly. He had a very quick recovery process. Any athletes of note?
The ones that rings a bell to me and it hits home is actually Neymar, a Brazilian soccer player.
Oh, yeah.
Plays for some of the European teams as well.
Yeah, you were mentioning that video, yeah?
Yeah, so So he did his physical therapy back in Brazil, where he's from, and there's a video that's online, and it's like 3 of the physical therapists just cranking on his knee. And he still has like his steri strips, or like the strips that you have post-operatively.
Oh, so it's fresh.
And they're just cranking on this guy's knee, and he's in pain, he's in agony, he's yelling, he's shouting.
Oh, no.
And they're just cranking on it. So that's probably what you don't want to go with that soon in.
That hurts me to think about.
Exactly. It was hard to watch. It was really hard to watch.
And that's just a perfect example of like knowing the healing stages and the recovery process. Like, I think with every athlete, they're always like, oh, he's going to come back super fast. But cells only heal so fast, right? So like the physiological process of the healing phase needs to continue to happen. And so you have to be patient with that. And you need to give the cells a time to repair and recover and do what they need to do. And inflammation being the first stage of that, it just takes a little bit of time. And you can't force it during that time either. And I think that's what you're seeing there in that post, where they're cranking on his leg, and that is a little brutal to watch.
Recipe for disaster, but it was hard to watch. Definitely hard to watch.
So just some things to keep in mind as you're coming back from an ACL. So if you see an athlete saying like, "Oh, I'm going to be back in 4 months," it's like, well, no, you're not.
And he actually hasn't even been cleared yet. So he tore his ACL, I want to say September, October, 2023. So he's coming up along that almost year mark.
Yeah, and that's about normal for a soccer player who plays at a high level.
Exactly.
And so when you see these professional athletes and they're like, "Oh, I'm going to come back in 6 months," I was like, "Well, what did we talk about before? Like it's 6 to 9 months for normal, like general everyday activities, and then 9 to 12 months for
more vigorous,
vigorous athletics and
high contact,
especially high contact and velocity of sport." And people try to rush it. And, it's good to be diligent and like really push the recovery process and do what you're supposed to do. But physiology still reigns king and things take time.
Exactly.
I think that's the athletic side of you is like, I got to be back tomorrow. And then the rational medical side of things is like,
slow down.
Yeah, you got to slow down. Like, it's going to be fine. It's going to be fine. The sport's not going to go away.
Nope.
I know you want to be out there on the field, but there's a level of like mental coaching you need to have with an athlete when they're coming back from an ACL, because there are times that you need to be the brake pedal, which is normally most of the time with athletes. And then there's sometimes you need to be the gas pedal and just be like, hey, we got to push this. We got to move forward. We got to get through this. So, as much as we're a therapist, sometimes you got to be a coach and you got to really push them and slow them down because they don't know the physiology of what's going on all the time. Well, unless they're really, really smart.
Can I start running at 4 weeks?
And no, you can't. So, all right, but that's it for episode number 7. We can talk more about ACLs in the future. Let us know if you have any ACL comments. Leave those below. And who's our sponsor for today?
Always us.
Us again. So this episode is brought to you by Resurgence Physical Therapy. So if you're looking to sponsor a podcast, we got one for you here. All right. So we'll see you next time in episode 8. Leave your comments, questions, like, subscribe, all those great things. Push all the buttons everywhere.
Yep.
And we'll see you next time.